Hello, my name is Amanda Perez, and I'm filming this video for an assignment for Palm Beach State College Advanced Health Assessment, which is a part of the BSN program. Today, we're going to be performing an abdominal assessment on our patient Teddy. The first step in abdominal assessment is going to be to ask your patient if they're having any abdominal symptoms. You're going to assess for any symptoms of nausea, vomiting, diarrhea, or constipation. You're going to ask the patient if they're having any problems with pelvic pain. Are they having any urinary symptoms such as frequency, urgency, or burning? Or are they having any problems with pelvic discharge? If that is negative, then you're going to move on to the next step of the assessment, which is going to be inspection. You're going to inspect the abdomen. You're looking for any bruising, scarring, distension, ascites. You're going to check the umbilicus, make sure that it is midline and there's no obvious herniation or distension. Once you've completed the inspection part of your assessment, it's time to move on to auscultation. To auscultate the abdomen, you're going to use your stethoscope. I'm going to start in the left upper quadrant, and I'm listening for bowel sounds. You ideally would like to hear bowel sounds every 5 to 15 seconds. Hypoactive bowel sounds would be indicative of either constipation or perhaps a bowel obstruction, which would warrant further assessment. You cannot just say that there are no bowel sounds in a quadrant unless you listen up to a full 5 minutes. You complete your auscultation in an orderly fashion. I start in the left upper, move to the left lower, right lower, right upper. When you're through with that, you're going to switch your stethoscope over to the opposite side, so that way we can auscultate the vascular parts. You're going to auscultate first over the aorta, which should be above the umbilicus, yet below the xiphoid process. You'll place your stethoscope gently. And what I'm listening for is a bruit, which is a blowing or swishing sound. I will then move over to the left and the right iliac artery, and the left and the right femoral artery. After I'm through with that, I'll listen to the liver and the spleen. When I'm auscultating over the liver and spleen, I'm auscultating for a friction rub, which you do not want to hear. After you're through auscultating, you are then going to percuss the abdomen. You're going to take your non-dominant hand, lay it flat on the patient's abdomen, and you'll use your dominant hand and you'll lightly strike to listen for what sounds you hear. You expect to hear dullness over the liver. If you hear dullness below the umbilicus in the lower quadrants, it could be indicative of ascites. After you're through with that, you're going to assist your patient to sit up, so that way you can assess for tenderness on the kidneys. You'll again take your non-dominant hand flat against the patient over the area of the CVA, and you will lightly strike bilaterally, and you're assessing for pain. If the patient is tender in the flanks, it could be indicative of either urinary colic, kidney stone, or some sort of urinary issue. Once you're through with that, you're then going to you're going to perform palpation, which is the next step of your assessment. Using light circular motions, you're going to again start in an orderly fashion. In the left upper quadrant, I am assessing for pain, tenderness. You'll ask the patient, does it hurt when I push you here? Rigidity, is the abdomen soft and non-tender in all 4 quadrants? Are there any palpable lumps or tumors or cysts, which you should not be there? You can then use a bimanual technique. Ask the patient to breathe in and out, so that way you can palpate the kidneys. Once this is complete, that was the final step of the assessment, and you'll document your findings. Thank you so much. I hope you have a good day.